Okay, so this particular unit that we are going to look at studying today is going to be, a new unit. And in this new unit, what we are looking at doing is basically studying about, health and social care, practice in general. Now, in detail, if I go into basically what we will be looking at doing in this unit would be to study how the policy and legislation around health and social care in general works within the UK. So we're going to be looking at various, policies and legislation which have led to the devolution of, how healthcare services are provided in the four different countries. When we look at Northern Ireland, Wales, Scotland, and England. Our focus, obviously, in terms of studies in this particular unit is going to be looking at the impact of how devolution of healthcare has helped different, countries within the United Kingdom to provide more tailored and bespoke services to the members of public. So that would be the first part that we will look at. So what are the major policies that we need to be aware of in relation to delivery of health and social care, and in general, we will study in detail about healthcare in England in particular. We'll also look at how the integration of health and social care services is happening or has happened over the years when the formation of NHS has happened in the 1950s. And then we will look at what are the choice people get in terms of exercising their rights towards, looking at getting healthcare services from the National Health Service. So this bit, along with, the impact of key requirements of how these legislations impact care homes, other kind of providers, care agencies, or any sort of other agencies which are involved in delivery of these services. Say, for example, old age homes. We look at people dealing with vulnerable adults. We look at mental health care nursing. So there'll be a broad aspect of what we understand in terms of the impact of key requirements, which are going to be, because of the legislation and regulation, and how do they influence, the service. Now, when we talk about legislation, we are going to be looking at key legislations like the Health and Safety Act, the Human Rights Act, the Mental Health Act. We'll be looking at data protection and GDPR in particular, the CARE Act, the Health and Social Care Act, the Equality Act. There are loads of them, but these are the essential ones that we need to be, aware of. And we'll understand to a little bit, as a broader extent, how policy formation happens in the case of health and social care, how changes are introduced within the NHS, what structure it goes through under the Department of Health. And in general, we'll go into a bit of detailing of some of these laws to understand them from a micro perspective, why and how these were introduced, and what is the area in which these laws now, help members of public and protect, say, for example, providers of health and social care, both on the public side and also on the government side. Now, in the second part of this unit, so it's got two learning outcomes. The first learning outcome is basically understand the policy context of health and social care. So we'll be broadly understanding the areas related to policy and formation of policy, and that would involve studying regulation and legislation. The second part that we're going to be looking at in terms of the learning outcome two in this particular unit, let me just bring that grid across so it becomes easier for us to be able to look into that rather than the presentation. Just one second. And the second part of the learning outcome essentially would involve understanding how this legislation and regulation helps healthcare professionals to deliver professional service within their profession. So generally requirements, what are the requirements that need to be fulfilled when we talk about, health and social care professionals or people who are deciding to work within this particular sector. And in general, that would also entail understanding necessary requirements. So when we talk about learning outcome two, in general, just magnifying this slightly. So when we talk about learning outcome two, we are going to be focused on understanding the requirements which are necessary for you to be able to work effectively within health and social care services. So things that we talk about in terms of, person-centered values, the 6 C's of care in general, and the attitude, focus on values, attitude, skills, and knowledge that a person needs to have when they are working as a health and social care professional. So when we talk about healthcare professionals, we are referring to people who work as GPs, dentists, nurses, midwives, health visitors, any sort of professional which is allied, to medicine. For example, clinical psychologists. We look at dietitians. We look at physiotherapists. We look at pharmacists. We look at the A&E staff, which is ambulance and emergency, paramedics, and in general, any other type of professional which is directly or indirectly associated with delivery of healthcare services to the members of public, which includes, say, for example, when we talk about over-the-counter medicines that you get from the pharmacy. So a pharmacist would be there. People who work within the administration or practice, for example, the practice manager within the surgery, and these people, or social care workers who essentially work and deliver social care services to, say, elderly or people within their homes, in conjunction working with local authorities like councils and other social care agencies. They would all constitute working as a health and social care professional. People who have the membership with HCPC, which is the signature body when we talk about the health and social care professionals. So healthcare professional council. When you do become a healthcare professional, some people, after having a qualification, also apply to get a membership, just like we have chartered membership for other professions like marketing or accountancy or law. You become a member of a chartered body. So here, the chartered body that health and social care professionals actually become a member of or take membership of, just like you have the Royal College of Nursing or the British Medical Association for doctors. Similarly, for healthcare professionals, there is a body called HCPC, which is Health and Care Professions Council. So this particular body is a body which normally people would take, a membership of. It's a regulatory and a statutory body which basically looks after, providing some sort of a membership to 15 different types of healthcare professions, which are covered, under this particular aspect. So people who are, chiropodists, people who deal with, say, for example, clinical side of conditions, people who are, dealing with hearing aids, occupational therapists, or, biomedical scientists, even, people who work within the health and social care sector as nurses, or in specific health and social care worker and healthcare assistant, they would essentially be looking at, this chartered body's, membership. So in learning outcome 2, we are going to be focused on understanding who are the people and what kind of skill set that you need to have to be able to work as a healthcare professional within this industry. And the second learning assessment criteria and the second learning outcome is going to be describing the importance of reflective practice. That means what we will do at some stage would be to primarily do an introspection into our own aspect of what are the, say, for example, say, for example, requirements are what are the requirements to work as a health and social care professional, and what are the qualities and what are the skills I have to work as a effective professional to get into this say sector, is what we will look at. So for example, things like the code of conduct, the care certification that you need to be aware of, person-centered values, and how best you understand your role. Why is personal development important? What is your duty of care? And the basic understanding that we will get from learning outcome 1, which is to understand various legislations and policies and how do you use them, is what we are going to be looking at as a reflective practice. That means you are going to do a bit of an analysis by doing a reflection on how and what qualities and skills you have to take up this particular profession. And that is what is going to be involved when we look at, describing the importance of reflective practice and understanding how do we adhere and make sure that the services that we deliver are going to adhere to some sort of a code which is required to work as an effective health and social care professional. So the reflective practice would basically mean this is a theoretical part. And I think when we do reflection, in most cases, whether it's teaching or any other profession, we kind of, dip down into the Klobb's learning cycle. David Klobb who created this particular framework of reflective practice, is what we will be looking at studying. And it'll be a theoretical part in which we understand Klopp's learning curve, wherein we, look at experience, reflection, identifying our learning points, and obviously then put the learnings that we've got into some sort of an action. So we'll be looking at the Klopp's reflective practice, and then basis that theoretical framework, you are expected to do a reflection on your skill set to see how, if you were to become a health and social care professional, how you would be essentially, obviously faring in this particular role. And that is where you'd be looking at dipping down into this particular process of what is called reflection, which is very important for health and social care professionals because it helps you to continuously look at improving your practice. And reflection is also important because it helps you to make sense of your experiences that you're gaining while you're working within this sector, and then you are analyzing them to see how you can practice and bring the best practices or adopt some of the best practices, let me put it this way, in order to improve these services that you deliver to the members of public. And this bit would be looking at, your own self in terms of your own knowledge, your attitude, your skills, and your ability to be able to interpret legislation and regulation and use that as a part of your duty to be able to provide the best possible care, to members of public, or to within a particular setup. If you work within a hospital, a care home, or a particular area like a surgery or a pharmacy, then how particularly you would use that best practice to be able to provide the best possible services to the members of public. So here you are going to be looking at writing something which is going to reflect on your own experiences, build up on your own experiences that you've had, but in relation to the theoretical framework. And you will basically kind of cross reference the things that you know, skills that you have, and the understanding that you have of this sector, and then relate them to the area of work that you do and how best you perform in your area of work. And that would be the process that you will look at for reflection. And in the last part, what we are going to do is the third session. So today and tomorrow, we are going to be focused on covering learning outcome 1 today, learning outcome 2 tomorrow. And then next week, we'll be looking at doing the assignment discussion in terms of understanding how we need to do the assignment for this particular unit. So this gives you a bit of an introduction into what this particular unit will entail, which is introduction to professional healthcare service and practice. And we will get on with, now understanding learning outcome 1 in a bit more detail. So any questions so far? Any thoughts, any questions so far? Okay, no worries. So let's start with some key terminology in terms of, understanding bits and pieces in terms when we talk about, what is policy in general and what is, policy in health and social care. So when we talk about policy in general, what does the word policy mean? So policy as a word, if I look at the dictionary meaning of it, it basically says, a course or a principle of action which is adopted or proposed by an organization or an individual. That means if we are to look at a place of work and there are things that we do on a repetitive basis, then at some stage, what the organization will do is create a policy or a process or a procedure that could be followed by everyone so that when the output is looked at or when the desired outcome is looked at, the outcome of that particular process would be similar irrespective of whichever person is carrying out that particular process. So when we talk about policy in general, we are talking in context of governance, which organizations in general create procedures and processes for. And this particular document, which is the policy, would also help managers essentially do or make decision or make the decision making process easier, because there would be a process of and deliberation which has already happened, basis which this and this due deliberation process which has happened has created guidelines and a process, and this process would then be becoming a plan for everyone to follow through. And when everyone follows through on the same plan and the output of the plan generally delivers the similar kind of output, that would be termed as something called a policy. So in the context of health and social care, various entities which are involved in creating policy within the within the health and social care sector, they would be businesses, private and public ownership businesses, because inputs are required, obviously from different aspects to be able to create a policy so that it is created in entirety. It is created in looking into all aspects of it, and then obviously you'll have governmental aspect, and obviously people who try and would be working directly under that particular policy to achieve specific objectives or desired outcomes. So when we in general talk about policies, policies serve as a statement or as a statement of intent, where it is typically used to implement laws and legislations or regulations in order to essentially, get desired outcomes. Now, when we talk about policy in the context of, say, health and social care or healthcare in particular, within the UK, this particular term, when we talk about healthcare policy, refers to decisions, goals, and actions that determine how care is administered and assessed within the system in the UK in particular. So when we talk about the National Health Service, and in general, when we do talk about the National Health Service, what we are looking at is the National Health Service is actually governed and legislated by a proper set of rules, regulations, and that is generally formed within the Parliament. Now, the NHS Act of 2010 essentially allows any such policies, procedures, or any such regulation to come before it comes into practice has to be approved by the board, and that is where what we look at is that when we talk about the definition of policy and legislation in healthcare, in short, we are talking about what are the various acts, regulations which have been set out within the National Health Service that would allow these services, which are healthcare services, to be delivered, say, for example, in an impartial manner, in a non discriminatory manner. It ensures equality and diversity, and every member of the public, irrespective of the background, culture, where they come from, will get the same set of services within the National Health Service. So, without any prejudice, without any sort of discrimination, everyone, any member of the public within the UK who's a UK citizen, essentially would get the same level of service from the National Health Service. And that is where the policy side of things tend to dominate, the Department of Health and Social Care. So any such new process, any such new legislation, any such new requirement which is to be introduced, it will undergo proper due diligence, and with proper debating and due diligence at some stage, if this is to be implemented nationally, even in the case of devolved, governments and health and social care regulations, they would be proposed as an act within the Parliament, go through the process wherein it'll go through first reading, second reading, third reading in the lower house, then it'll go to the upper house. There'll be final reading, then it'll at some stage be passed, and then it'll go to the royal, it'll go to the monarch for a royal assent. It then is signed off, and that is when it becomes an act. So when we talk about policy and what is the role of say policy and procedure, within the health and say for example social care sector, what we are looking at essentially is the whole process through which the system essentially is made to work within the National Health Service, and this part would essentially constitute talking about basically the policy and regulation side of things, in order to ensure that members of the public typically get the best service from within the National Health Service setup. So things like um, when I look at the role of policy and when I look at the role of legislation, what is it that I'm going to get as an individual when we talk about as a member of the public, when I need, say for example, say for example, medication, or when I do fall ill, then at some stage when I do require medication or any sort of treatment, that is provided to me, and that is provided to me by the guidelines laid down as per the policy and process in the National Health Service. I would be looking at obviously getting these services in terms of, say, clinical services or some sort of care, which would be defined within the health care purpose, the aim of the whole setup of National Health Service. And here the policymakers would have debated and then would have clearly defined what would be the various purposes that would be fulfilled by providing day-to-day healthcare to the members of public. It will also constitute regulation. For example, if anything is to go wrong, or for example, if I don't get services as I've desired for, then in those cases, you have a fallback mechanism wherein you can actually go back and say, for example, register or complain to, for example, against a provider. And in those cases, it would be that there would be emphasis created within the organization for good governance. But then also, you would be looking at, the government side of things. When we look at policy and regulation, they would essentially be looking at creating collaboration and partnerships which would allow the best the best part of services to be delivered in collaboration with private public partnership. And in some cases, you look at within the UK, most of the medical services are provided by the NHS, so it's 90% mostly nationalized. But there are private players who also do provide services in tandem sometimes. And a case in point that I'll give you is because of the COVID, there were a lot of backlogs on hip surgeries or breast implants or other side of procedures which is what has created a backlog of processes or operations which are pending in the National Health Service. And in some cases, things like hip replacement or heart surgeries, NHS in those cases refers them outside to private providers, wherein it is funded by the NHS, paid for by the NHS or the National Health Service, but patients are required to undergo treatment or care, receive treatment, receive care after treatment from the private providers like Bupa. You look at Spiral, you look at some of the other trusts which are there, and they are basically in tandem working with the National Health Service. And then the main aspect of policy and legislation is to also look at inclusion and equality, because I cannot say that I come from this background or I have settled here or I've immigrated here and I get second class service from the National Health Service or I do not get preference. So in this case, the legislation ensures that everyone understands their legal duties. They understand that duties that they deliver have to be related to ensuring equality and inclusion within health and social care. And that is where the emphasis is on the importance of tackling any sort of healthcare equalities and promoting inclusivity in the delivery of these healthcare services to the members of public. And this is something which will be happening all across, because these are things which are adopted at the policy level and at the parliament level. So the acts and legislations which are introduced are mandatory to be followed by any sort of an agency or provider which is delivering any sort of services to the members of public under the banner of Department of Health. And that is where the policy and legislation part of it would be important. And this would be regularly reviewed and obviously updated depending on how these changes have to be introduced within the National Health Service. Is that okay? Any questions on this so far? Okay, what we are also going to do is look at a quick video. And this particular video that I'm going to show essentially talks about, in brief, talks about, what are the organizations that make up the National Health Service and how do they collaborate together to be able to deliver these services to the members of public. So this is a particular video that I've taken up from the King's Fund, which is the website. And what I would want to do is basically play this video so you understand, say, for example, when we talk in general, because obviously health and social care sector and the healthcare services or the National Health Service is a vast topic. But what we want to be able to do is understand, say, for example, when we know that there are health and social care standards which are prescribed under the legislation and policy formation within the National Health Service, how do various departments or partners, essentially, which is public-private partnership, look up and obviously then work together to be able to deliver these services. And that's specifically related to the health and social care standards, not because obviously, as I mentioned, it's a vast topic, but just generally looking at the health and social care standards. So let's listen into this particular short video, which will give us a bit of a perspective in terms of why policy and legislation is important and how is it put into context of implementation when we talk about various different organizations working, and delivering some of these services to the members of public. So let me just play this video.
Changes are taking place across the health and care system. What does this mean for the organisations that make up the NHS? How will they collaborate with other parts of the system? And what will these changes mean for you and me? When the NHS was set up, it focused on treating single conditions or illnesses. Since then, our health and care needs have changed. More of us are living longer, and many have multiple conditions that require regular, ongoing care. However, this hasn't been reflected in the NHS's structure, a patchwork of organisations that often work independently from one another. Navigating this can be confusing and can have a negative impact on our experience of care. So, for some years now, health and care staff and leaders have been working to bring organisations closer together to better meet our needs by working
in a joined-up way. Primary and secondary care, social care, mental health and community health services have been seeking to partner with each other in different ways. At a very local level, GP surgeries have been coming together to form primary care networks, groups of practices working together across areas called neighbourhoods. By sharing resources and working closely together with other local people and services, they can provide a wider range of services than a single GP surgery. Health and care organisations have also been working together across larger areas called places, often covering the same area as a local authority, where large parts of the NHS budget are spent. Here, local government, charities, residents and NHS partners can work together to understand and meet local health needs. But previous laws have prevented services becoming even more joined up. The 2022 Health and Care Act aims to change this and make it easier for organisations to work together. But what do these changes look like? Organisations are now coming together across even larger areas to form integrated care systems, partnerships of health and care organisations that plan and pay for health and care services. There are around 40 integrated care systems across England, and although they've existed for some time, the Health and Care Act gives them legal status, as well as new powers and responsibilities. Integrated care systems are made up of two parts: integrated care boards and integrated care partnerships. Integrated care boards decide how the NHS budget for their area is spent and develop a plan to improve people's health, deliver higher quality care and better value for money. Integrated care partnerships bring the NHS together with other key partners, like local authorities, to develop a strategy to enable the integrated care system to improve health and well-being in its area. Are also coming together to form provider collaboratives, new partnerships that can bring together providers such as hospitals, mental health services, and community services. So how are these new structures funded? Integrated care systems get most of their money from NHS England, which is the national body for the NHS in England, and sets the operational priorities for the health system. It's responsible for the health services you and I access day to day, which are inspected and regulated by the Independent Care Quality Commission. The Department of Health and Social Care sets out what the NHS is expected to deliver for the money it gets from the government, which comes from our taxes. It also holds budgets for some of the other areas that have an impact on our well-being, like public health. Throughout these new structures, local authorities play a key role. They receive money locally and from national government, which goes towards funding a range of services that support our well-being and prevent ill health. So, what does this all mean in practice? The Health and Care Act has put in place a legal framework that enables services to work more closely together, so it's easier for you and I to receive the care we need when and where we need it. For these changes to succeed, staff and local leaders will have to work with one another differently, alongside key partners in local government, the voluntary sector, and communities themselves. Of course, services face other challenges like workforce shortages, growing waiting lists, and the impact of the COVID-19 pandemic. While the new structures won't fix all these issues, by enabling services to work more closely together and join up services for patients, it's hoped that the health and care system will be better able to meet our changing health and care needs in the future. Find out more about how the health and care system is changing at
.uk/explain.
So one part of it, what you understood in this particular video was that how does the Health and Social Care Act and legislation is helping reshape or let's say regroup some of the old practices within the NHS which have been introduced when the NHS was formed. So in general, the reason of, obviously understanding and looking at this particular video, the last part of it was very important, is because it talks about how the Health and Social Care Act, which was introduced initially in 2012, and then the revision of this act in 2022, allows local surgeries and, private public, let's say, public, setups to be able to come together and form what is called the primary care networks to be able to provide more effective and more localized services to the members of public. And this particular act essentially allows these primary care networks to come into some sort of legally come into some sort of binding so that these services are then effectively delivered to the members of public within a particular place or within a particular local council. And this is the bit that we need to understand when we talk about, policy information, or when we do talk about, bits and pieces related to legislation in general, when we talk about learning outcome one. So here is where what we need to be focused on, understanding how the legislation is required. One, it is impacting the care provider, and how this is being modified or adapted to meet the newer, let's say, requirements within the health and social care sector. Now, what you see on this slide is essentially a way in which how we see the Department of Health and Social Care structured and under the as a setup within the government. So when we look at the UK government, and obviously we look at the Treasury, but and then when we look at the Department of Health and Social Care, so you have Department of Health and Social Care, you have the NHS England, you have Northern Ireland Assembly, because these are 4 devolved nations under United Kingdom. So you have National Assembly of Wales and the Scottish Parliament or Holyrood. Now here is where the the development of what is called the legislation typically tends to happen, which is passed and agreed in the Parliament. And then once it is passed, they then become acts and regulation, which are then implemented within the National Health Service or any sort of a setup which is related to delivering the health and social care services to the members of public. So within England, you have the NHS England under the Department of Health. In Northern Ireland, we have the Department of Health, Social Services and Public Safety. In the case of Wales, it is called the Department of Health and Social Care Services. And in the case of Scotland, it is called the Directorate for Health and Social Care. Now, why is it important at this stage? Because we need to understand what, because of the fact that there is, there is devolution within these 4 countries, and because there is devolution of powers, that means that the independent, parliaments or setups within these countries can actually form policies and procedures or acts and introduce acts and legislations as they deem fit, and how these would then be benefiting the members or public within that particular area. So when we do talk about, the formation of act, if it is generally introduced in the Parliament in, in London or in England, part of that is then, obviously also introduced in other nations, and that is where the Parliament or their local assemblies have the ability to be able to tailor, bespoke, or change some parts of it to make sure the implementation of it happens. Um, let's say when we talk about the concept that it can be locally applied and make it more adaptable, to people, or essentially people essentially in that particular area. So that is why, under the Parliament Act, devolution of healthcare has already been done, and the four different, NHS England, along with the state assembly or the local assembly in Wales, and when we talk about the directorate in Scotland, are able to form their own policies and their own regulation in order to ensure that the best services are delivered in a best possible manner to the members of public. Now, in terms of the various, so that's the bit that we want to understand in terms of, just broadly what is devolution of healthcare and healthcare budgets. For example, if the NHS England announces, or the Parliament in the new year, when the budget is produced by the Chancellor and they announce certain investments within the National Health Service, these investments would also then be applied across the Welsh Assembly or the Scottish Directorate of Health and Social Care, or in some cases, the Northern Ireland. But the way in which how this will be implemented and what budget will be allocated is specified, and then the local assembly or the Parliament has the ability to then further utilize this budget in areas that they feel it'll help the members of public the most. Now, when we talk about different legislations, these are the various legislations that we are going to be looking at studying, and they would be, as I mentioned briefly earlier, the Health and Social Care Act. So when we talk about the Health and Social Care Act in particular, this particular act ensures that, when you work within a particular location, or when you work especially within the National Health Service, your employer has certain responsibilities, and you, as an employee, you have certain responsibilities to keep you and others safe. So essentially, this is related to the physical environment in which you work. The environment needs to be clean and healthy, and obviously should be free of any defects or any sort of problems that can, affect you mentally, physically, and create, a sense of non-well-being. So the Health and Social Care Act essentially is a safety regulation which primarily, allows the employers, gives out certain responsibilities to both employers and, the employees. And if these responsibilities are, obviously implemented and imparted by individuals on a basis wherein you do your part and the employer does their part, then this would ensure that the place of work is safe. The equipment, if you use it in your place of work, is also safe, and it has passed certain tests or standards before it is, before it is asked to be used. For example, when we look at X-ray machines or MRI scanners or other machines, so people have been given proper training, and they have had proper certification to be able to operate and work with this machine, so that there are no harmful effects which can happen to the individuals at your place of work. And then obviously this act also ensures that we carry out risk assessments in particular, and ensure that anything which is being asked to be used by either a staff or a member of public who is receiving the care, then they have proper facilities and proper equipment in place with competent personnel. That means people who have been adequately trained and have been given the training to be able to use this or use the equipment and then provide the service to the members of public, would be the remit of this particular act. So proper safe working place, making sure equipment is safe, you're properly trained, risk assessments are carried out to ensure that nobody is put in the harm's way, and then proper facilities which are available along with people being adequately trained and having the skills to be able to use and deliver some of the services to the use the equipment and use them to deliver services to the members of public. We also look at the Mental Health Care Act. Now, Mental Health Care Act obviously was introduced initially, in the 1983, but later on it was, obviously amended, and there are amendments to the acts which are introduced over a point in time. So when we look at, say, for example, the Human Rights Act, sorry, we look at, say, for example, the Data Protection Act. It was introduced in 1998, but it underwent some sort of changes with the Journal Data Protection Regulation, which is the inclusion of social media and data which can be stored in relation to persons' credentials on the internet or on the cloud, and how this can be saved, where it can be saved, how you can ask this data to be removed, and for how long this data is stored electronically. These bits were updated in the updates to the Act in 2016 when GDPR was added to Journal Data Protection Regulation was added to the original Data Protection Act, which was introduced in 1998. So most of these acts and legislations also sometimes undergo a change, or they are updated because with the changing times and requirements and the adaptations have to be done, and there are addendums and obviously updates to these acts also produced. So when we look at the Mental Health Act of 1983, this was when it was introduced, was an important piece of legislation because it consolidated all disorders or all areas wherein people had what is called mental disabilities, and it addressed the aspect of how mental health care is provided, how is it assessed, what treatment, and what are the various rights the individuals have when they are diagnosed with mental health care disorders, and how the treatment of these can be provided to the members of public was all encompassed in this particular act. And obviously, when the acts are introduced, they have a proper purpose. They have, proper defined areas in terms of how the assessment and treatment is to be provided. What are the various rights of individuals? There will also be, certain areas in which how this particular services are to be delivered, defined, and last but not the least, codes of practice, or essentially some sort of a practice code would also be defined in the act, which would allow this to be, let's say, used, and then using those practices, the best practices, the act can be implemented to provide services to the members of public. And then if there are, updates required, the 2007 was an update to this particular act, and that essentially introduced what is called the mental health care services within Wales, and that addendum to the act, which was done in 2007, was an update to the Mental Health Act of 1983 when it was introduced. So I have got handouts which I will essentially provide, and in the presentation there will be individual slides. They will be available so that in one slide it gives you a bit of a summary for you to be able to understand what these acts are and why they are important, and how they are put into the context of the National Health Service. We don't want to be looking at these acts. Obviously, the acts that are picked up in this unit, and when we talk about, obviously the legislation in general, the acts that have been taken across for the point of discussion are directly related to working as a healthcare professional, or directly related to the health and social care services that are provided by, healthcare professionals who work within this particular sector. So there are lots of other acts and legislations. I don't know an exact count, but maybe there are hundreds of it, in terms of various things. But we are not bothered with the acts or legislations which are not related to health and social care services in general. So here in the context, we are going to be looking at only acts which are specific to the National Health Service, to healthcare sector, and to healthcare professionals in general. Now, very briefly, one of the main acts that we talk about is the Health and Social Care Act of 2012. Now, this act, when it was introduced, is actually it changed the way how health and social care services are delivered specifically in England, because this act introduced a major change wherein local commissioning groups and local authorities were essentially made responsible for delivering services in the health and social care sector to the member of public. Now, up until that time, these services were all centralized, and obviously there was a single body which was essentially governing and obviously dictating all the various changes which were introduced. But with the devolution of power and obviously the creation of what is called the CCGs, which is a term that you need to be familiar with. It is called CCGs, which is clinical commissioning groups. So if we look at the NHS structure, let me also bring across the NHS structure that I think would be useful at this stage. The reason I want to do this is because when we do talk about the NHS, what we also need to know is that how the NHS is actually formed. So let me just bring that structure across. Give me 1 second. Here we go. So this particular structure of the healthcare system in England in particular, or in England and Wales, was introduced, and there was a reorganization which had happened with the Health and Social Care Act of 2012. So when we talk about this particular structure in general, what we are looking at is that when we look at how services are delivered to the members of public, obviously this is a structure wherein we understand the Department of Health is in the outer periphery. Parliament, State Secretary of State, and obviously other government departments, they are outside. Then the first layer through which this is delivered are what are called regulators. So you have the CQC, you have the Human Tissue Authority, you have MHRA, which is the authority which looks after approval of drugs and medicines, MHRA, which is here, and then you have professional regulators, Royal College of Nursing, the British Medical Association, the HCPC. So these are, and then Health Research Authority, which is basically the research wing of the National Health Service. They tend to be the regulators under the Secretary of State and the Department of Health, which basically introduce legislation and regulation. Then if we go down a layer further, what we see is national organizations which basically interpret these regulations and policies and convert them into what are called policies and procedures, which will be adopted by various departments to run and effectively run day-to-day services. So these would include PHE, Public Health England, which played a significant role. Some of you, if you recall, there were lots of campaigns during COVID which were introduced by the government, the face, space, and save kind of campaign, the 2 meter social distancing rule. These were all communicated to the members of public by marketing campaigns, and these campaigns and the coverage which was essentially sent out from the government to the department and then onwards to the members of public, is a signature thing which the Public Health England as a body does. Then you had other NHS trusts which basically deliver these services. You have the NHS England healthcare watchdogs, and some of the authorities which basically work and convert these acts and legislations into workable policies. They are in the second layer. Then you have the local organizations. So, for example, when we talk about local organizations here, the powers to be able to essentially utilize the budget, how to best utilize the budget allocated by the government within the NHS for the NHS, and how to ensure that the budget is utilized fairly in a way that it allows the best of services, or the budget to be utilized in a way wherein it runs and provides the best possible solution, was basically I would say delegated to what is called the local authorities, or what we term as local organizations. But within local organizations, we talk about devolved government. So when we talk about Greater Manchester Combined Authority, the budgets and decision making, we have a mayor in Manchester, Andrew Burnham, and obviously the responsibilities of how the various acts and legislations would be enacted within the Greater Manchester Authority area is decided in general by a local authority. Similarly, you look at London Authority, you look at Liverpool, you look at some of the other areas, Leeds, for example, there the budgets have been devolved. That means the local authorities or organizations, local government organizations have the ability to be able to decide on how the budgets are going to be best utilized to provide these services. And that is where the formation of what is called clinical commissioning groups, CCGs, which is made up of doctors, nurses, and other healthcare professionals, were made responsible for buying healthcare services to meet, patient needs. That means the budgeting side of things is within the hands of the CCGs, and they decide how these budgets are to be put into, practice, or put into, practice for the purposes of making them available to the members of public. So local health watch and these local organizations are the ones which essentially then decide how budgeting is to happen. And the intention of these agencies essentially is to work together to provide and meet the local needs of the individual. Now, within that, you have different setups and organizations which receive this budget, and they then deliver these services firsthand. So, for example, you have the surgery, you have the pharmacy, you have opticians, you have dentists, you have healthcare centers, community healthcare centers, you have ambulance and services, and of hospitals, care homes, social care workers, community working groups. These are the ones which essentially work finally together to be able to deliver services to the members of public. So the formation of acts that we talk about is basically done at the parliament level, at the government level. Then they are adapted into the, let's say, the local organizations and national organizations first, and then into the local organizations, which is where the clinical commissioning groups are important. So when we talk about the Health and Social Care Act, this basically was important because it changed the way health and social care services are delivered in England, whereby they made the clinical commissioning groups or local commissioning groups and local authorities responsible directly for providing health and social care to the members of public. So the idea is to understand some of these acts and how these acts essentially then help deliver effective services, to the members of public. Now, I've got a few slides that I put together just to understand this Department of Health and Social Care within England in particular, and how it leads to the creation of any sort of legislation or regulation within England. There is one slide that I put in particular for Northern Ireland, and to give you an idea, when we did talk about um, the devolution of services within health and social care, and obviously when we talk about Northern Ireland, we have the Northern Irish Assembly, and that under which the Department of Health, Social Services and Public Safety, looks at creating this framework which essentially provides these services to 1.8, 1.9 million members or members of public within Northern Ireland. And then I've got one slide for Wales, which basically talks about the National Trust or the Department of Health and Social Care Services under the Welsh Assembly. And then last slide, which talks about under Scotland, the national under the Scottish Parliament, the creation of the Directorate of Health and Social Care Services, which essentially provides the services to the members of public. So this particular overview helps, I hope, helps you to understand, the requirements of, policy in the context, policy formation and legislation in the context of, healthcare services in general. Any questions on this so far? Right. Now, let's look at going into some of the assessment criteria. There are two assessment criteria, for learning outcome one. The first one talks about identifying the legislation, policy, guidelines impacting the healthcare delivery. So here, in this particular assessment criteria, we need to be looking at understanding the key legislations which have been created, and how these are then transformed into policies by national level organizations. And then these policies and guidelines are adapted by the local organizations under the national organizations to then impart, the services to the members of public. So in order to understand this in particular, we start with the National Health Service Act of 1946, which basically, after World War II, the government essentially introduced this act. And what it did was it nationalized the National Health Service and the associated part of it within the UK or United Kingdom. So the government basically approved that all services under health and social care will be publicly funded, and the healthcare system. So when we say we are when we say we are a welfare estate, why do we say we are a welfare estate? Anybody? Any ideas? Why do we say that UK is a welfare estate? Any idea? So when we say UK, is a welfare estate, is because when we talk about the basic services, which is education, healthcare, and housing, and obviously, if you look at some sort of economic benefits, these are benefits that the government actually pledges to provide to the any citizen of the United Kingdom. So if you are out of a job, you get some sort of a job seekers allowance. There is some sort of benefit-based services there, which is covered under universal credit. If you are housing, if we look at, and education, if we look at, and healthcare, we look at, these are the four services which essentially make UK a welfare estate. That means if the government, if for example, in this case, why this was introduced after World War II is because the concept of welfare estate, came out of World War II, because the country was in shambles and the government had to pick up and, address various social and economic changes which were then happening at that point in time post World War II. So when the reconstruction of United Kingdom started, Beveridge report came about in the 1942, and that report essentially laid down the foundation and suggested, or basically gave an outline of some sort of a outline, in the sense it created a comprehensive plan of how the government will look at reforming the UK as a state, and that is where it identified these five basic evils, which are things like want, disease, ignorance, squatter, and idleness. That means if you are without a job, you're without a house, you don't have good education, and you don't have access to health and social care services, then it basically destroys the state. So that means it destroys the country. So in those cases, the government adopted this strategy, and obviously UK became a welfare state. So when we look at housing, healthcare, education, universal tax credit, and these kind of benefits, when it is provided by the government within a particular country, then the country is essentially considered as a welfare state. So when the national health services were nationalized, and obviously it was decided that the healthcare services would be provided free of cost to the members of public within the United Kingdom, this was introduced in the initial act, which is called the National Health Service Act of 1946. Later on in 2008, it led to the creation of what is called the NHS Constitution, and this was sealed, and obviously further, powers were given, and this was under the NHS Act of 2010 when it was created. And then we have basically different acts that we need to look at studying, and that is where the handouts that I will provide would be useful. But very briefly, I've given some introductions to some of these acts, like the CARE Act. You look at the GDPR, or the Data Protection Act of 2016. There are certain key regulators or agencies. Now, how many of you are aware of the key agencies that we look at, within the UK, specifically, when we talk about the health and social care sector in general? What agencies are you aware of, or regulators are you aware of? Any ideas? So in the context of, UK and healthcare department in general, there are a few agencies, but when we talk in general about key agencies, which basically, help in the formation of regulation and legislation, we talk about 4 or 5 in general. Now, one of them is basically, NICE, which is National Institute of Health and Social Care Excellence. In short, it is called NICE. Now, this particular agency or is an organization, it provides guidance on formation of national policies, and it advises the Department of Health on how do we improve health and social care services. So it also creates guidelines for practitioners and the commissioners, which are the heads of CCGs, to ensure that best care for patients is kept at heart in terms of when we look at utilizing money from the taxpayer, because obviously this is a service funded by the state. So NICE in general focuses on healthcare quality and clinical experience, which basically are services provided by various authorities or organizations within the National Health Service. Now, the second agency that we talk about is called the Medical and Health Care Products Regulatory Agency, which is MHRA. Now, this particular agency is a regulatory body, and it's responsible for overseeing approvals to any sort of medication, medicines, medical equipment or devices, and any sort of products which are used for blood transfusion or, say, for example, any sort of transplants within the UK. Now, their role is very crucial because it ensures proper testing and thorough analysis through which any sort of danger, for example. So let me put it the other way around in a positive aspect, that this plays a crucial role in ensuring safety and quality and efficacy of any healthcare products which are introduced in the UK or within the National Health Service. So, for example, if I was to have a heart condition, I was given a pacemaker, or if I had to wait for a kidney transplant and some sort of urinary, tract infusion or product was being transplanted or given to me for such time till I get a kidney transplant. These devices, products would be tested by the MHRA, and they would then be given a safe seal of approval. And until that is given, no medical devices, equipment, or any sort of licensing cannot be done until it is approved by this agency. So it provides a regulatory framework, and it also ensures that it enforces regulations related to medical devices, medical products, and medication in general, so that everyone from pharmacy to hospitals to GP surgeries or any sort of community centers which are involved in prescription usage of machinery, which is used for the services being provided to members of public, is actually conforming to the standards that it defines. So this is the second most important, agency or regulator which that you need to be aware of. The third one that we talk about is Care Quality Commission, CQC. I'm pretty sure that most of you have come across this particular word, CQC. So Care Quality Commission is a regulator which is an independent body outside the government, and it's appointed by the government. It's an independent regulator which ensures, and their main role is to basically ensure that health and social care services are provided to the public that meets the required standards which are set in quality, safety, and effectiveness by CQC as a body. So their main role is to ensure inspections, regulation of various healthcare providers, hospitals, care homes, GP surgeries, dental surgeries, amongst lots of other different types of organization. And their inspectors or inspections assess the quality of care which is being provided against the standards which have been set. So there are lots of CQC standards, and I think 52 or 53 standards, and they have to be conform when these are introduced, or when they were introduced by CQC. These standards have to be essentially then adhered to and conformed by any such organization which is providing services within the health and social care sector. Now, it's quite a big topic, but at the end, you need to be aware of CQC. There are lots of standards that they have, and these standards essentially work on the 5 C's of what CQC's framework is based on: safe, effective, caring, responsive, and well-led teams to be able to deliver these services to the any sort of healthcare services to the members of public. There's another body. Obviously, there are lots of bodies. So there's King's Fund as well. But let's look at one other body which is important, is because when we look at COVID and we look at likes of pandemics or epidemics which tend to happen, you would see the National Institute of Health and Social Care Research, NIHR. This particular body is again, a semi-governmental body, and this, body, National Institute of Health and Care Research, is basically the largest funder of health and social care research which happens in the UK. So when we look at new medication coming out, when we look at trials being done, when we look at the COVID vaccine coming out, you know, NIHR plays a very crucial role because it ensures that it provides essentially enough funding for research to carry on or for research to happen on certain things. For example, currently we are trying to find drugs or create drugs for cancer, cure for cancer. Essentially, we are looking at creating cure for diseases like AIDS and some of the others. So there's a lot of research which is happening, and this is being funded by the NIHR in general as an agency under the government or Department of Health, and their role is to ensure that they provide the facilities and technology to be able for the researchers within the health and social care sector to be able to research, conduct research, carry out these studies to basically bring out solutions to some of these, chronic illnesses or diseases which are plaguing humanity. So when we talk about research, we talk about research promotion. When we talk about support, which is provided in terms of funding to any such clinical, public health, or social care facilities under the Department of Health, that is going to be done by National Institute of Health and Care Research, so NIHR. So this is an important body which plays a very pivotal role in advancing research and innovation in the area of healthcare in general within the country or within the UK. So these are very important bodies, and their opinions, their contributions play a very important part in the creation of various legislation and acts as far as the National Health Service or the healthcare services in England and UK are concerned. Is that okay? Any questions on this? Okay, the second assessment criteria talks about how do we describe the impact of key requirements on the National Health Service, or for example, in this case, the healthcare services. So when we need to look at the impact of service requirements, which basically are required by us to be able to use and then use these and then deliver the best services to the members of public, what we need to be able to do is basically understand how does the government essentially understand what is impact and what are the key requirements to ensure that the impact of these regulations, legislations, and acts actually allows the best services to be delivered to members of public. So the three impacts that we look at in particular is effectiveness, experience, and safety. So when we talk about in general how the government looks at the process of measuring impact, we look at delivery of integrated care, or IC. I don't know if you paid attention, but just briefly going back to the video that I looked at, showing you earlier, there was a mention of something called the Integrated Care System, ICS. Now, the whole idea of how the services can be working together to provide benefits and seamless service to members of public is generally achieved through by working on what is called the integrated care system. So when we talk about how integrated care is delivered, that means people understand the the requirements of how this care is to be delivered to the patient. Why is there a need? And and then we put together, say for example, resources, facilities, equipment, medication around that, so that the best patient is able to get the best possible care. That typically part is created under what is called a care plan. The care plan has discussions with key people who would be providing this care. It will be the patient, the family members of the patient, the staff, nurses, doctors, GPs, therapists who are going to be providing this care to the patient at some stage or the other. They will all be consulted, and the best thing, the best way, possible way in which care can be essentially provided would be discussed and then created and documented as what is called the care plan. And when this is predominantly done, then the care plan can be used as a document to measure the impact of how care is being delivered to the patient, and whether that care is having an effect or not, whether it's helping the patient improve, whether it's helping the patient get discharged, an early discharge from the hospital, whether it is helping the patient to essentially get back on the feet as soon as possible. And that would be acting as a bit of a barometer on quality standards and obviously how the care is being delivered to the patient. So when we talk about the impacts that we have to look at in terms of key requirements on healthcare services, it is the quality and effectiveness of healthcare delivery that we need to look at. And that is what is the consideration of impact that we talk about in the case of this care being delivered to the patient. Now, from an assessment criteria point of view 1.2, we need to discuss this impact from a point of view of legislation and policy. That is what we have studied in Learning Outcome 1. So what we need to be able to relate to is the government policies and legislations, and what and how they play a significant role in shaping these healthcare services. For instance, let's look at the Health and Social Care Act of 2012, which introduced changes to the structure in which how healthcare delivery is being done and how it impacts the way services are organized and provided. That means the creation of clinical commissioning groups or CCGs, and then the devolution of powers to the local government and authorities or organizations allowed the Department of Health to say that, okay, now we have given budgets to the local authority and the local people. They can decide how this budget can be best utilized to providing the best possible care to members of public in a particular area or in a local area. And when we talk about, say, further as an example of how we measure impact, when we talk about the COVID-19, pandemic, and when we in general talk about this particular pandemic, what you would generally see is that the pandemic had a substantial impact on, obviously, let's say, on how the healthcare services, were delivered. So what that meant was that all of this, because of the pandemic, it essentially put a lot of pressure on various services. That means there was a backlog of, a lot of operations were postponed. We look at a lot of other, treatments were which the patients were lined up for example, hip replacement or heart surgery or any sort of other such surgeries. They were put onto a back burner or on a waiting list, and that impacted, obviously how, they impacted delivery in the sense, if I was given a waiting time of 3 months, that waiting time actually had become 3 years or 2 years, and that had a significant impact on the patient's health. So when we talk about the example of a pandemic and how this had an impact on the healthcare delivery in your area and in secondary care, for example, people who have had the surgery and had to receive care at home from health and social care workers, then in those cases, because of the COVID pandemic, people were restricted because of lockdowns. People were restricted; they couldn't travel, and that also kind of disrupted the services which were required or were to be delivered to patient post their surgery or in helping them in rehabilitation was affected. So when we talk about the overall impact of COVID-19, we see that it obviously had a significant impact on how the healthcare services were delivered during that particular period. And that is again something which was it is related to an impact because this affected how other services were impacted because everything took priority to deal with COVID, and hospital beds had to be empty. All staff had to be deployed towards meeting the COVID hospitalizations, and that is where the impact was felt across for other areas within the service. And This is what we need to basically explain by taking up an example to deal with this particular assessment criteria, which is describing the impact of key requirements of service because of a particular situation. So in this case, you could take up an example of COVID-19. The second example we could take is sometimes we talk about shortage of funding within the NHS. Or the third example could be when we talk about shortage of manpower or trained manpower within the NHS. These would have significant impact on how health and social care services are delivered to the members of public. So if we don't have adequate nurses, sorry, if we talk about and we look into the news, sometimes we do get to hear that, GP surgeries, in order to see a GP, I had to wait 2 weeks or 2 months. And this is because of the shortage of trained manpower within the National Health Service. So in such cases, if you do not have adequate manpower within a GP surgery, and you have to wait for a number of weeks to be able to see your GP to get a prescription or to get a diagnosis, then this can have an impact in terms of how these services are being delivered and what is your experience. And obviously, the frustration, and in some cases, it can be even fatal because you've not been able to get it diagnosed in time, and this has led to a fatality. And this is where we will be looking at understanding what is the impact of some of these shortages, which then affect the delivery of services to the members of public. Is that okay? Any questions on today's session?
No, that's fine.
Okay. Now, there is a particular document which I just want to show you, and that document essentially is a good document which I will make available on Moodle, and I would suggest that you need to go through this document. Now, even if you do not read it thoroughly, my suggestion would be to skim through this document, because this document basically is related to your assessment criteria 1.2, and it talks about the importance of understanding and measuring the impact of key requirements of how National Health Service provides the services to the members of public. So it is a presentation which basically is a report, but I would genuinely say that if you are looking at understanding the assessment criteria in a bit more detail, especially 1.2, I would suggest to go through this, which will give you a good understanding of how do we look at the impact when we take up examples of, say, shortage of manpower, or when we talk about shortage of funding within the healthcare service, or we talk about the COVID-19 pandemic. You would be able to get a very good example and an idea by studying this particular report, which will allow you to understand the impact of key requirements on the service, and in particular the three impacts that we want to understand, which is effectiveness, experience, and safety. Is that okay? So we will end the session here today, and this allows us to comprehensively cover learning outcome 1 of the unit, which is introduction to professional healthcare service and practice. And then we'll meet up tomorrow to discuss learning outcome 2 in a bit more detail, with regards to obviously moving ahead in terms of reading this unit. So thank you so much for attending. If you think of any questions, do feel free to drop it on the chat. I'm going to send you a copy of the recording shortly, so that if you need to review anything or go back and revisit what we have discussed today, that can be done by going into the recording that will be available shortly. The presentation and this particular handout is available on Moodle under this particular unit. And my suggestion would be to do a bit of a reading in regards to this session, after this session, and that will help you crystallize and understand what we've discussed today in a bit more detail. So until then, thank you for joining, and I'll see you guys tomorrow.
All right, thank you.
Thank you.
Portia, please check your message. I've sent a message for you.
All right, okay, that's great. No worries.
Portia, yeah.
Thank you.